From our 22 News Broadcast Center, this is 22 News InFocus.
Good afternoon and welcome to 22 News in Focus. I'm Ciara Speller. According to the Massachusetts Department of Public Health, opioid-related overdose deaths in the state continues to be a public health issue. There were over 2,300 confirmed and estimated opioid-related overdose deaths in 2022. In the first 3 months of this year, there were 522 opioid-related deaths. A national opioid crisis brought to light over the overprescribing of painkillers, leading to lawsuits against pharmaceutical companies and corporate pharmacies. So today on 22 News in Focus, we're looking into the efforts of the Opioid Task Force of Franklin County and the North Quabbin Region to help reduce the number of deaths from opioids and support people in recovery from addiction. So joining me now are Northwestern District Attorney David Sullivan, who co-chairs the Opioid Task Force, and Liz Wynot, Director of Harm Reduction Services with Tapestry Health. We want to thank both of you for being on the program today.
Thanks for having us.
Yeah, thank you.
So DA Sullivan, I want to begin with you, and I want to ask you, what is the Opioid Task Force, and when and why was it created?
The Opioid Task Force is based in Franklin County in the North Quabbin Region, and it's a public-private partnership where we try to address the crisis of opioids in our community, the overdoses and the overdose deaths. So we formed over 10 years ago, and now have 6 professional staff that are working with the Opioid Task Force and with the community.
And so what is your mission?
Our mission is to reduce opioid addiction and also to prevent overdose deaths and non-fatalities rather.
And I also want to ask you, how many organizations within the community partner with the task force, and how do you decide which is a good fit for the task force?
The task force from the very beginning is community-based. We have over 400 members, and that includes anybody from, we have harm reduction, Tapestry, we have educational institutions, we have treatment facilities, we have hospitals, we have law enforcement. Sheriff Donlin, who is the co-chair of the task force, is involved with his sheriff's department, probate court, other courts, just a wide variety of folks, including folks that are in recovery and their family members. So we want to be as inclusive as we can so that we can build solutions based upon community needs and community wants.
And looking at initiatives, what are some of the initiatives that you offer?
Some of the initiatives that we have, we base our task force off of 5 committees. So the first one is healthcare solutions, where we work on different solutions in the healthcare field. We also have an education committee where we work with schools and we work with community groups to educate folks about the overdose. We have a treatment and recovery, which Liz can talk about in a little bit, and that's very important. Workplace development and also housing. And then the last one is about that recovery part of what we do.
Yeah, and so we hear a lot about this issue in Hampden County, but what are some of the issues specific to rural areas when it comes to addiction services?
It's so difficult in a rural area because of transportation and also the lack of outpatient, inpatient treatment. Back in 2013, there wasn't a single acute treatment bed in all of Franklin County and North Quabbin. That's over 35 communities that had no real ability to receive acute treatment without having to go to Hampden or Worcester or Boston. So working in a rural community is very different. It's great because we've had the communities buy in from the very beginning. It's very, very important that we emphasize how important that community members are. And one of the key persons to our task force has been Dr. Ruth Potee, who works with the sheriff as the physician for the jail, but also is an addiction specialist, and she's given us great advice on how to address the opioid situation.
And Liz, I just have some numbers here. So the DPH reported that Massachusetts in 2022 had 47% of all opioid-related overdose deaths, and there were people between 25 and 44. 43% were between 45 and 64, and males comprised 72% of all opioid-related overdose deaths. So what are the demographics you're seeing in your region when it comes to these deaths?
That's a good question. So I just want to say that Tapestry's harm reduction programs, we operate in Franklin, Hampshire, and Hamden County. And we now provide syringe services in 11 different communities. And so for Franklin County, we provide services in Greenfield and Montague. The trends are similar to the data. We're seeing a rise in overdoses across the age span, but I think the biggest number of increases happen between 35 and 44. It's unfortunate, but it's being seen across the entire lifespan.
Yeah, and so two words that we're hearing a lot right now are fentanyl and xylazine. Now there are ways to test these drugs before someone uses them, but how are these drugs getting mixed into heroin and cocaine?
Yeah, so the heroin supply, I won't go into it, but it's changed drastically in terms of where the drugs are coming from. So maybe 10 or 15 years ago, you could trace it back to a crop in somewhere in South America or something like that. And then with the opioid epidemic and then the rise, I guess, in people using, and then just things that have happened after that, there's been a change where the heroin coming from like crops is being reduced drastically, and it's going more into some kind of lab setting all over the world. And being able to pay attention to what's in the drugs at a specific time is just getting more and more complicated. So over the past year or two, we've seen a drastic increase in xylazine, and fentanyl has been drastically increasing in the drug supply within probably the past 10 years or so. Fentanyl is much stronger than heroin, but it is important to know that Narcan does reverse a fentanyl overdose. Xylazine has come into the drug market, I think, really in response to trying to expand or lengthen the amount of time that someone is high. It's a sedative for veterinary use. So they've come into the drug market because the drug market is changing. There's really no good way to put it other than that. And I think that it'll continue to change, and it'll just get more and more volatile as long as things continue the way they are.
All right, we thank both of you for your insight, and we're going to continue our conversation in just a minute. When we return, we'll be discussing some of the programs offered through the Opioid Task Force. You're watching 22 News in Focus. We're back now with 22 News in Focus, and today's topic is on the work being done by the Opioid Task Force of Franklin County and the North Quabbin Region. In the past, people who had committed crimes to get money for drugs went to jail and may not have gotten treatment that they needed and the support for when they were released. And when a person, especially a parent, is incarcerated, the entire family is impacted. In recent years, the incarceration treatment and support model has all changed. So we're going to bring in our guest again, DA Sullivan. My first question for you: how are people assessed now when they're arrested for drug-related crimes?
Well, it's changed dramatically. First of all, Sheriff Chris Donlin, who is in charge of the Franklin House of Correction and Jail, has been very progressive in making sure that people are immediately assessed by a booking officer and then by a clinical nurse that's in that facility, so that they can get the right treatment at the right time and be able to get inductions for buprenorphine or methadone in a timely way. So it's really changed, and I think the attitude toward not only myself as district attorney, but law enforcement and the sheriff, is that this is a disease. It's a chronic disease that needs to be treated that way, like you would treat diabetes or heart conditions. So it's dramatically flipped, that it's not an arrest model, but a treatment model.
And so you mentioned treatment. So Liz, I want to ask you, what are the treatment options when somebody is incarcerated?
Well, I think the DA can also speak to this. So what I will say is that, again, we work in Franklin, Hampshire, and Hamden County, and we have interactions with each of the jail settings. And I've personally been very impressed by seeing the changes that have happened since the Opioid Task Force has started in Greenfield. I think it's really important, and it was such a good move to provide access to medication for opioid use disorder as soon as the person enters into jail. And then in the Franklin County Jail, there's also, it runs on a social work model, so there's people that work with the individual while they're incarcerated and then helps them integrate back into the community. And just comparatively, from my observation, I've found that to be the best, like the most forward-thinking in terms of a law enforcement setting.
And I think also the modality is dialectical behavior therapy, where they work one-on-one with individuals, also group therapy, so they can change their behavior. So it's just not finding a medication, but also finding a long-term solution, so that as they move forward in life, that they don't depend on these substances.
Mm-hmm. And I want to ask you, D.A. Selvin, what is the Franklin Family Drug Court, and what are the services that are offered?
The Franklin Family Drug Court is very unique. There's, I think, 6 in the country, and they were able to get a federal grant. So they work directly with the Franklin Probate and Family Court, and they give wraparound services to people with substance use disorders, whether it's alcohol or opioid use disorders. And what's really important is that they have counselors, they have recovery coaches, they have a clinical nurse. All these things that sometimes they slip through the cracks. In probate and family court, many times people would come in, they'd leave, but they'd never be assessed for that kind of addiction or that kind of problems that arise out of that addiction. So it's really helpful for children and families to have that type of a wraparound service at the Family Drug Court.
Yeah, Liz, could we have you touch on the Massachusetts Behavioral Health Access website and what people will find if they visit that website?
To be honest, I'm not too familiar with that website. I know that its intention is to access treatment and to go on there and to find things right away. It's difficult because the reality is that there just is a shortage of treatment options in Western Mass, and like the DA said earlier, in rural areas like Franklin County, it's really, really tough. So it's good to think of ways like through the website of access, but we also need to continue to think about like how to provide actual care, including treatment beds. So that's really where I hope to see more of, I guess, and what we're always trying to struggle to get more of.
Right, and there's also the substance use helpline, correct?
Yes. One thing I do want to mention is the Massachusetts Overdose Prevention Line. It's overseen by DPH, and what it is it's a phone number that you can call if you end up using opioids alone. So one of the main things is that most deaths from overdoses happen when the person's using alone, and it's really important to use with others. However, there's a lot of stigma, and it's tough for people that use. And I was thinking about this earlier, that a colleague of mine in Massachusetts, he was really well known and did a lot of great work, and he was abstinent for over a decade, and then he ended up using alone, and he died. And I feel like that's happening more and more, so we need to get more and more creative in terms of helping people to not use alone. So the Massachusetts Overdose Prevention Line is a really good and important option for people.
And the substance abuse hotline that Massachusetts runs is very important because it gives resources for recovery, for treatment, to make sure that people can get linked into those as quickly as possible.
Okay, there really is so much to cover here with this topic, but we're going to continue our conversation after a short break. You're watching 22 News in Focus. Thanks for staying with us. You're watching 22 News in Focus, and we're discussing the services offered through the Opioid Task Force of Franklin County and the North Quabbin Region. The Opioid Task Force has a rapid response team, and we have DA Sullivan here with us and Liz Why Not. We're going to bring them back in. And DA Sullivan, I'd like you to explain what the Community Opportunity Network Navigation, Exploration, and Connection Team is, also known as CONNECT.
It's a very important program because it's a post-opioid overdose intervention where peer recovery coaches go out and see that person who has overdosed or their family members and they provide resources to them. They also let them know that there's peer recovery services and also the treatment modalities that are available to them, because people are always scrambling for a place to go or people to see. So they give all those resources in a packet, so then they put them in a better place so they can get treatment in a timely way.
And what about the community information resource packet? You just touched on that.
Most people in the community don't know much about Narcan, so information about Narcan, about peer recovery, about those resources in the community that they otherwise would just skip altogether. So they've worked really hard on the task force to make sure that it's ready to go, that people have that 800 number or that particular number to give a call for that treatment recovery services.
Yeah, and so a lot of progress has been made around Narcan, right? It's now available for free. Some towns like East Hampton, they offer nalox boxes, and several municipalities and school buildings, businesses as well, also now being equipped with these nasal naloxone doses that people can administer. So Liz, is access to Narcan or naloxone helping to reduce these deaths?
Oh, most definitely. It's been one of the most important things, I think, that has happened in terms of providing something that is completely safe to administer to the wider public, especially to people who are at highest risk of witnessing an overdose. And so just quickly, so naloxone reverses overdoses for opioids. And it comes in a very simple spray that you just stick up the person's nose and press. And it over the past years, it's just gotten more widely available. It's been amazing to see the continued recognition of it. We at Tapestry, we do a lot of different forms of naloxone training. So we work with people who use drugs and people who are at greatest risk of overdosing and witnessing an overdose, and we provide education around how to prevent and how to respond to an overdose. And we also are able to give out Narcan at no cost on an anonymous basis. So the person doesn't have to give us their name or anything like that. And in addition to that, we try to get as creative as possible to get naloxone out into the community. So through the help of the Opioid Task Force and also a federal grant called Mass Heal, we've been able to partner with the OTF to install nalox boxes all around Greenfields. So a nalox box is basically, it's an emergency box in that you can go up and just open it up and it's not locked, and there will be naloxone in it that you can just take in case you witness an overdose. So in Greenfield, especially with the support of the city government, specifically the mayor and her department, we've been able to place them in public places where there's just been known to have use, where people may use drugs. And they've also been placed all over many different parts of Franklin County, in places like convenience stores and just other places where people can go very anonymously and take it.
So very easily accessible now.
Very,
Yeah.
yes. Yeah.
Getting better.
Getting better, yeah,
Yes.
yeah. Yeah.
And they can get it in pharmacies too.
Yes.
So, which is important, that they could go
Very
into
important.
CVS without a prescription and get it. Some may be covered by insurance, but those that don't have it covered by insurance and don't have the money, then go to Tapestry.
Right.
They have it readily available.
And Liz, you touched on, education and community outreach, but DA Sullivan, how about in terms of the task force, education and outreach?
So important. I mean, with education, we've been able to fund Communities That Care. It's a youth organization geared to youth about misuse and about protecting people, making good decisions. And we want to keep funding the community at the grassroots, whether it's schools or community groups, that they can get that information out to teenagers and young adults.
And opening this question up to both of you, what are some ways that individuals, businesses, communities, organizations in the community, I should say, can help you with your mission?
Staff at Tapestry, in the past couple of years, they created these stickers that say, like, we carry naloxone, and we've done a lot of business outreach where staff will just go into local businesses and they'll offer to provide Narcan naloxone at no cost and do a training with them. And then we've asked for those stickers to go up into windows. And I think that, like, the general public being more supportive of initiatives like that would be really helpful. And I think that in general, like, the more open we are about overdose and the more kind of willing we are as a community to learn how to reverse an overdose and carry naloxone, the better off we'll be in terms of preventing death.
I think businesses, people in recovery, they need jobs, they need housing. It's reducing the stigma because so many people are afraid of people finding out about that addiction, but we can't help people unless they come forward. And so reducing that stigma so they can get treatment, they can be in recovery, and they can lead a normal life. So it's really important for the community to do that. And the community members that have joined our task force, they've given our expertise, they've given support, they've been part of vigils, they've done a lot of things to make it so much easier for people to come forward and get the help they need. And it's all about saving lives.
And lastly, I just want to have you both touch on supervised consumption sites, what we're seeing here in our area with that.
Supervised consumption sites have been around for 20 years. They started in Canada, they're in 13 countries, and I'm in full support of these small places where people can go and use these drugs safely. 99.9% of all the folks that die of opioid overdoses are alone. And let's not have them alone, but have a safe place for them to use that product.
And I just want to add that so at our sites at Tapestry, our syringe service programs, we're able to provide a wide range of services. We provide people safer injection equipment, as well as counseling, access to naloxone, counseling and testing for HIV, hepatitis C, and STIs, and supported referrals to treatment and other services that they need, and everything else related to what they need in that moment. But once they leave us, they go and are often forced to inject their drugs alone and in places. So, I mean, you can say that we already have consumption sites, but unfortunately, they're people's bedrooms and their, restrooms. And so, to allow for places like Tapestry to allow for the person to safely use would be a great step toward reducing death.
Yeah, thank you both so much for your insight. Really appreciate that.
That's fabulous.
And we'll have some final remarks when we return. You're watching 22 News in Focus. Today we've been discussing the work being done for substance abuse prevention, intervention and treatment by the Opioid Task Force of Franklin County and the North Quabbin Region. We want to thank both of our guests for being here. DA Sullivan, Liz, why not? We really appreciate you being on the program. Really important stuff. Thank you so much for that. And if you missed any of our program, you can watch it in full on our website, wwlp.com. From all of us here at 22 News, have a great Sunday.